Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.911 WTC responders have threefold higher risk of lung cancer. Breaking number 148, emergency responders to the World Trade Center collapse on the 11th of September have a nearly tripled risk of lung cancer, a new study says. Break the toxic dust and fumes that lingered over Ground Zero likely boosted lung cancer rates among rescue workers, researchers reported this month in JAMA Network Open. Break-in number 156, we discovered that responders with more severe exposures to WTC dust had up to 2.9 times greater risk of developing lung cancer compared to minimally exposed responders working on the pile who reported low dust exposure or used personal protective equipment, PPE, and number 157, lead researcher Sean Clouston said in a news release. He's an epidemiologist and director of public health research at Stony Brook University in Stony Brook, New York. Break for the study, researchers tracked more than 12,000 WTC responders, among whom 118 lung cancer cases were diagnosed between July 2012 and December 2023. Break all participants filled out a detailed questionnaire that included time spent at Ground Zero, their exposure to dust and odors, and their use of protective equipment. Break not all exposures occurred in the first horrifying days and hours following the terrorist attacks on September 11, 2001, researchers said. Break many responders spent months digging through Ground Zero, regularly churning up clouds of toxins as they recovered bodies and cleared away debris, researchers said in background notes. Break those most directly exposed to the airborne dust and fumes from the WTC rubble were 2.9 times more likely to develop lung cancer, the study found. Break those moderately exposed to dust and fumes had an 86% increased risk. Break the research team said this appears to be the first published study to link WTC toxic exposures to later lung cancer cases. Break-in number 156, previous studies did not identify any such link between lung cancer and WTC responders because of the short latency of exposures and low smoking rates in WTC responder populations, and number 157, researcher Dr. Paolo Boffetta, Associate Director for Population Sciences in the Stony Brook Cancer Center, said in a news release. Break researchers plan to continue tracking the health of first responders. They also aim to improve their measures of the specific toxins to which the speak emergency personnel were exposed at Ground Zero. Break-in number 156, this study establishes a need to begin to understand which specific carcinogens found at WTC sites might have increased the risk of lung cancer, and number 157. The team concluded. Break sources Stony Brook University, news release, October 9, 2025. JAMA Network Open, October 9, 2025. Break disclaimer, statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources for MedWatch, Drug Alerts, Daily Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.